Hello, I'm Kelsey Bjornsgaard, and welcome to a discussion from the Radicalization Awareness Network. Today, we will be exploring the connection between mental health and radicalization to violent extremism, a complex and at times contentious topic that has gained prominence following recent attacks over the last few years. And to help us unpack this topic, I'm joined by our guest, Eva Jimenez Gonzalez, Doctor of Clinical and Forensic Psychology and Chair of the RAND Mental Health Working Group, and by social psychologist Desponina Limniotaki.
Hello.
But first, let's take a look at this.
At a recent meeting in Rome, the Radicalization Awareness Network's Mental Health Working Group discussed the contemporary connections between the mental health of individuals and violent extremism. The global crises of the COVID-19 pandemic, the Russian war of aggression in Ukraine, the energy crisis, environmental catastrophes, spiraling living costs, and the rise in myths and disinformation have all led to anxiety, hopelessness, and fear, and in many cases, extreme anger, often over specific issues.
There have been protests this evening.
Protesters clash with police outside Parliament.
Extremist narratives can function as a tool to channel this anger, addressing the fear and anxiety, and in many cases giving meaning to those who may feel isolated and without hope. And we have seen the emergence of very individualized ideologies, rooted in personal grievances towards different groups, and in many cases, government institutions. The existence of trauma and other serious mental health disorders among significant numbers of violent extremists has huge implications for mental health practitioners in the field of PCVE. So how can practitioners and the RAND Practitioners Network rise to this challenge?
It's quite difficult to maybe sometimes make that connection where poor mental health is bleeding over into extremist tendencies and where that connection is. But areas where the connection has been more pronounced. So when there are instances of, say, psychosis or of serious mental illness, what sort of impact does that have on extremism? And can you point to any specific cases where that's really been a driving force in violence or extremist actions?
I understand that serious mental health disorders fascinate the public, and we are hooked on watching drama series on Netflix. But the truth is that you cannot really apply a diagnosis on individuals. Take, for example, the Breivik case, the person who killed so many people in Norway in 2011. We cannot work with how the people feel about certain situations. We have to be very careful in examining somebody if we need to find answers to the human behavior.
He suffered from abuse in his childhood. He was rejected in his schools, different schools, so was kind of bomb, prepared to do something sooner or later. So that's because it's so important to share information between the different actors, to collect the traits that we really know that will be involved and influence in radical population, and to train the people who will be in these processes, in this institution, controlling that kind of factors. So we can check all the different cases that all of us know, and we have the same scenario. The traits were there, nobody informed about them.
If we don't pay attention to how a situation develops, but we only care about the damage and about labeling who has done what, then we will never find the beginning of how a radicalized individual is made. If we do look for something to be labeled, then we are missing the whole picture.
So in a lot of it, it seems to come down to the circumstance in which we find ourselves, in the world at the moment. There's a lot of challenges, there's a lot of change, there's a lot of things that inspire fear, and it sounds like there's a lot of things that make people feel like they've lost control. how does that sort of connect in with the kind of vulnerabilities that an individual may then have?
When someone has a trauma, they interpret their life through a special glasses. So that people who has emotional, psychological issues, they will interpret all the daily life based in the trauma. They will connect what has happened before to them with the reaction that they are living right now. So right now we are living one crisis after another. We don't have time to recover from the first one. We have to face the second, the third, and the fourth. And we cannot forget that the crisis that we are living right now are global. So everyone is affected.
So vulnerability lies in loss. People have lost material things, they have lost relationships, but most importantly, they have lost meaning. And it is difficult to find something for them to believe in again.
Right now it's quite more difficult to define who is the real danger for community, who is the threat for the community, because there is a melting pot of different people and situations. And even we cannot detect them before. So even if they have the radical ideas, even suspecting that they have kind of mental issues, until they act violent, we cannot arrest them. This is from the force security. But from our perspective, from the mental health area, we can do something, prevention.
Mental health is often sort of discussed, I'd say most, around when we're thinking about lone actor terrorists, but also with incels. Do you think that this association with mental health and this focus on lone actor terrorists and incels, is this a useful connection? Is this something that you see play out in your work?
Well, gender matters as well, of course, even in the radicalization processes, of course. We have another question, new masculinity, and they have to deal with it. Some people, they don't have the skill to deal with that kind of information. They are losing the power that they normally had in the previous years. And right now we are studying what is the real trigger for attacking of these people. And we normally find so many autism spectrum cases in incels. There are people who doesn't have the skill enough in order to create healthy relation with women, with female. So they feel that they deserve to be loved by others without doing nothing because they don't have that skill.
But isn't that a social situation as well? Because if people don't have skills, especially the youth, then aren't we, the adults, the people who are our practitioners and educators and policymakers responsible for their cultivating their skills and introducing them to coping material? Because the incel thing is such a new construct, but we have left boys behind. I'm not talking about men, I'm talking about boys. Many questions nowadays, and nobody can answer to them, which means that we have to re-educate all sexes in order for equality to be achieved.
So it's been relatively well documented that among the incel community, instances of mental health disorders and neurodivergence, as you said, autism, are much more common. Have we seen the same in so-called lone actor terrorists? In your experience, have lone actor terrorists been more likely to exhibit mental health disorders?
90% of the cases of lone actors, terrorists, have some mental issues. Personality disorder, most of them, but schizophrenia in all his spectrum, from paranoid to psychosis, dependence, depression, anger, and affection disorder as well. Feeling an outsider, feeling alone, feeling that he is not engaged with anything, feeling so many hate and anger.
Many of them have no connections with their immediate family or don't have any friends. All the people they know in real life have abandoned them or rejected them.
And don't forget the people who receive or who suffer abuse in their childhood. It's very important as well.
So another group that might require sort of specialized mental health support is returnees. So individuals who may have traveled to join violent extremist organizations and have undoubtedly witnessed or potentially taken part in traumatic instances. What kinds of challenges do these individuals present for mental health, and what kinds of specialized support do they need to be able to, rehabilitate and eventually reintegrate into society?
So we need to treat them as victims. We cannot push anyone, not only that kind of inmate, any inmate, we cannot push to be involved in any kind of assessment, not even rehabilitation process. So we need to explain to the governmental sector that we have to work with them, because if not, they will be relieving sooner or later, and we will have a problem, even bigger problem that when they enter. But we need to convince them first to be involved in our program, exit program and psychological programs.
They have nowhere to return, really. In certain countries, there are no programs to help them move on to a next stage in their lives.
And what can practitioners and psychologists have in mind when they're dealing with these individuals?
We have to enter their world. We have to get to know them, how they think, how they act, what they believe in, and we need to be involved in what people are doing in real life. We cannot just tackle a problem from the safety of our offices or of our headquarters. The mental health world is changing dramatically. There's a lot of reading, a lot of talking, and a lot of interacting that we have to do.
So it sounds like it's a matter of really understanding the individual's experience, what they've been through, what might have driven them, and really sort of trying to connect with them on kind of an individual level rather than sort of treating them as, an archetypic example of, a vulnerable person or, an actor.
We have to treat them, rehabilitate them, and reintegrate them, as my colleague has mentioned first. And we cannot forget that they are the perfect scapegoats. So it's impossible to do that kind of cases only from the mental health issues, but the mental health issue has to be the one who monitors it or the process, because there are so many steps involved in so many. It's a very long process, very long, more than 2 years. We need to give them different alternatives, how to behave, how to react, how to cope and deal with your concerns.
So I know we've only scratched the surface on how complex this topic really is, but I'd love to spend some time talking about what PCVE practitioners specifically can do to help address this challenge.
I would like to add about training. Training is key. We need to train not only mental health professionals as well, those people who are working with the people who could be in the process of being radicalized, youth workers, educators, parents, the community policings. Even the mental health professional is not the same to treat with normal patients, I say normal, with those who could be in the risk to be radicalized. We have to tell them what are the factors that he will be involved in a violent situation against himself or against others. And we need to share information, challenges and limitations in between different mental health professionals, social, clinical, forensic, educators, because we cannot work in an isolated way. So for me, that will be the best approach.
We have to speed up the good work and keep up networking, but also embrace different cultural worldviews and be more inclusive, because we need to hear the voice from practitioners all over the world, not just from a particular part of the world or from countries that have suffered a lot.
Prevention is the best intervention, so don't forget prevention. We have the information, we have the tools, just communicate between us.
So keeping this cooperative approach in mind, what role should mental health professionals play in preventing and countering violent extremism?
Mental health should underlie everything, I believe. We could provide a map of knowledge and a framework on which we can all work and make new information and decide on what to do next. And then everybody sees and takes it from there and works on their own particular field.
Mental health is a transversal issue, affects every single aspect of process of radicalization. So we have to support all the decision and protocol and strategy decided to counter and prevention that kind of violent action who can be involved in this vulnerable population.
We have to push for interdisciplinary approaches. We cannot just accept groups of working people who come from one field or another field, but those two fields then work separately. We have to work together, give input, and has something new to offer to the work we are doing all together.
But we need to increase the number of mental health professionals in all EU institutions. We normally work supporting other actors, but we need to have people trained in radicalization process and the number enough in order to deal with all the cases that we normally have to assess, train, evaluate them, and the cases are rising and rising and rising.
What are the real sort of material barriers to getting more mental health professionals involved?
Because until now, we have not aware of the importance of mental issues, mental health problems. There are so many doctors who are dealing with physical well-being, but right now, we really know that the mental and affection issue has to be in the policies, in all the policies, not only for dealing with radicalization issues.
And you know, people go to mental health practitioners when damage is done. And they ask us to do detective work. What has happened in this case? People have to realize that mental health is about prevention first and foremost. So we have to turn from the last ones in the row to go first and then take it from there.
So there needs to be almost a complete overhaul of how we understand the place of mental health in prevention, starting from the policymakers, from the PCVE practitioners, to the mental health professionals themselves, but also on a societal level, that until we can sort of understand and come to maybe a common understanding of the role that mental health can play, it won't be able to actually fulfill its potential for really supporting prevention.
Mental health matters with survivors, with FTF, with lone actors, with incels, with people who are vulnerable to be in a process of radicalization. Mental health matters as well in the policy that the security force has to define as well, to detect and to control those populations. So
that is why our job is so difficult, because we have to reach out to them. We cannot expect people to come to us for guidance. We have to go down there to do groundwork in order to see any results. This is preventive work. Preventive work is not just theory, it's hands-on actions.
So this presents a serious policy challenge within a given country, but also between countries, considering the transnational quality of extremism and radicalization. How can the RAND Practitioners Network help support coordination between EU states?
We have to have more get-togethers and discuss everything under the prism of how we could all improve our work together.
Can you speak a little bit about your experience of being in, the Practitioners Network, how it's helped you, sort of either refine or maybe amplify your own approach?
I have gained so much knowledge, I don't know what to make out of it. So hopefully I can positively influence other colleagues to follow this example and make more discussions, organize more discussions around the subject of radicalization.
We are collecting information from all the practitioners who are dealing with these cases. So we are the very first who are receiving the insight of the inputs for the cases that we can define as connected with mental health issues. We need to have kind of power to design what should be the approaches, the best approaches with these people, with the vulnerable people.
Cooperation is key when prevention is at stake. So we have to always bear in mind that we are not alone in it. We shouldn't be alone. We shouldn't be alienated from the greater community, which is really our colleagues and the people who are willing to talk to us and us talk to them and create new material for the world to be demystified.
Yeah.
Well, this is a fascinating topic, and it's been a wonderful conversation that we could probably continue all day. But I think with this, we will close out. So a big thank you to our guests, Eva Jimenez Gonzalez.
Thank you.
And Desponina Limniotaki.
Thank you so much.
And thank you for watching. I hope it's been as interesting for you as it has been for me. If you'd like to find more information about this topic, you can visit the RAND website, where you can find papers, resources, and information about upcoming events. See you next time.